in there?
No.
In the developed world. In the developed world, I mean.
Oh, now you are really limiting it. One of the highest in the developed world, because the problem here is insurance. The problem is that you have 40 million people approximately, and they are the poor people, and they are the ones who don't have insurance, and they are the ones who are giving birth to malnutritioned children who die early. So it's an insurance and Medicare type problem in the United States. In Britain, for example, you have welfare state, socialized healthcare. Everybody can get free healthcare. France, same. Germany, same. So the Europeans have developed a welfare system in healthcare, and next door to you, you have the system in Canada. Totally socialized welfare in medicine. Anybody can walk into a hospital and take care of a health problem for free. But in this country, it is a free market system. And 40 million people cannot afford the free market. And so the answer is Medicare reform. And I'm delighted to see that this is a fundamental part of the debate in the presidential election. So there is hope. I don't think this will continue for long, because too many people are writing and people are making movies about the comparison between France and the United States in medical aspects of healthcare. So go and see those movies and become activists in the country for getting rid of the 40 million people who have no insurance benefits. Over to Florum for a question.
I was wondering if you could address the role of religious institutions like the Catholic Church in the health of the world.
I would like to seek the Fifth Amendment of the United States Constitution but on this question, but the church is an institution. It is an institution which is historical. In other words, it's not born today. It's born 2,000 years ago. And over 2,000 years, it has been examining itself and rectifying its theory, and hopefully the constant rectification is progressive and progressively good. But obviously there is no such thing as perfection in life. Perfection is only God. And so the church, like the mosque, like the temple, like the synagogue, all make mistakes. And the whole point is that each mistake should lead you to improve the situation. And I do not know on what case you are focusing. Are you focusing on the case of family control, for example, of birth control?
I was referring more towards like AIDS.
AIDS. Well, the AIDS, we know what is the problem of AIDS. The problem of AIDS is that if you have it, and if you're going to bed with many women, you're going to spread it. And each woman, if she is going to bed with many men, is going to spread it. So there is no way in which we do not know. We know the vector for the spread of AIDS. And so how are you going to control it? You can control it either by cutting down on the incidence of multiple acts of sex, or you can cut it by putting in barriers, which is condoms, etc. Or you can by putting in a permanent barrier, which is abstinence. Now you can choose. The Catholic Church has chosen the concept of abstinence. It's a feasible concept. You can choose that, or you can choose any of the other two. Choose, you're a free person, it's a free country. I would not blame the Catholic Church for choosing only one out of the three known methods of preventing the spread of AIDS. And I think it's unfair to say, oh, they are not, we want free sex and they want abstinence, therefore it's not good. I'm sorry, they have a point of view which I think is intellectually defensible. Over to Tinek for a final question.
Hello, Ambassador Kamal. Thank you for joining us this morning. My name is Rachel McGurr. I'm a sophomore here studying international studies. My question is in reference to developing civil society. In order to raise awareness of the needs of the people, how could an impoverished nation strengthen their own civil society, independent of international aid and persuasion? It does take time and effort, but when there are so many different organizations and countries influencing the people, how is it possible to develop a unique civil society?
Very good question. Congratulations to you. Obviously, you are a thinker, therefore you have a future in this whole problem of global health. Civil society, first of all, developing countries are not so much behind the curve in civil society. There is mushrooming civil society in the developing world. A country like Nepal, which is lost up in the Himalayas, has 80,000 registered non-governmental organizations. 80,000 in Nepal. And so there is a mushrooming of civil society around the world. I gave you the example of this philanthropic organization in Pakistan, which is treating 1.5 million people every year. Civil society. It has nothing to do with the government. It has to do with the people. So a lot of work is being done around the world. Don't be despondent about civil society. Secondly, you said that civil society needs assistance from outside. That's not true. The major part of the funding is effort. And effort these people in developing countries are willing to put in. And so civil society is on the rise around the world. And that for me is, as I said before, the only real hope. It's the lighthouse for the future, is the way in which civil society is going to address problems of global health and public health policy formulation. Only civil society can do that, and I find that civil society is very active in developing countries. Sometimes, in fact, civil society is not so active in developed countries, because most of civil society in developed countries is talking about Iraq. And that's not the problem. The problem is, what is Iraq doing to the economy and the health of the United States? That is the problem that civil society should be focusing on. And I'm glad, as I said, that at least one out of the 3 candidates in the United States presidential election is focusing on that aspect. Good luck. There is hope. Over to you to close this session from your end. I don't know whether it's being closed from TNEC or from Madison.
From TNEC, Ambassador Kamal. Thank you very much for being with us today and enlightening us. The information that you provided was truly very interesting. This is our last video conference for the term. We would like to thank Lehigh, Lock Haven, and Montclair for joining us today. You will be able to find video stream of all of our video conferences at www.fdu.edu, and we encourage you to revisit the website. Thank you once again, and we'd like to wish you all a happy day.
Same to you. Thank you all for being so attentive to a problem which is difficult. Goodbye until we meet again.